Have you ever noticed changes in the color, smell, or consistency of your semen? Felt pain or discomfort during ejaculation? Many men over 50 notice these changes but feel too embarrassed to talk about it, even with their doctors. What few realize is that semen can reveal critical information about your overall health, from infections to more serious conditions that demand immediate attention. Hello, I'm Dr. Jane Taylor, and here on FOFR, Male Secret 60+. We talk openly about men's health with serious science-based information and no taboos. As a physician specializing in mature men's health, my mission is to bring clarity to topics many find awkward, but that are essential for your quality of life. If this is your first time here, welcome. Subscribe now and hit the bell so you don't miss our weekly content on men's health, vitality, and well-being. Today we're tackling a subject rarely discussed openly: male semen and what it can tell you about your health after age 50. We'll cover normal changes versus red flags, what each color means when a smell signals trouble, consistency and volume, pain during or after ejaculation, blood in the semen, and, most importantly, when you should see a doctor without delay. Get ready for honest, practical information that could literally save your life. First, what exactly is semen and how is it made? Semen, also called seminal fluid, is the liquid released during ejaculation. Many men think it's produced only in the testicles, but it's actually a complex mixture from several glands. Only 2 to 5% are sperm produced in the testicles. 65 to 70% comes from the seminal vesicles, glands behind the bladder, a fructose-rich fluid that gives sperm energy. 25 to 30% comes from the prostate, a milky alkaline fluid that protects sperm from vaginal acidity. Small amounts come from the bulbourethral and urethral glands. In a healthy man, average volume 2 to 5 milliliters, half to 1 teaspoon. Normal color, whitish gray or slightly yellowish. Consistency, thick and jelly-like right after ejaculation, liquefies in 20 to 30 minutes due to prostate enzymes. Smell, mildly alkaline or chlorine-like, caused by a compound called spermin. pH, slightly alkaline, 7.2 to 8. After age 50, some gradual changes are completely normal. Volume decreases by about 0.03 milliliters per year of age. Slightly more watery consistency. Weaker ejaculation force. Longer refractory period. These are natural aging changes and don't necessarily mean anything is wrong. Chukpuri, semen color, what each shade means. White, grayish, or milky white. Normal and healthy. All glands are working properly. Pale yellow. Usually harmless, especially after several days without ejaculating, oxidation. Certain foods, garlic, onions, asparagus, curry, dehydration, or B vitamin supplements. No concern if no other symptoms. Bright yellow or greenish. Warning sign. May indicate infection, prostatitis, epididymitis, or STIs like gonorrhea, chlamydia. Often accompanied by pain, burning when urinating, pelvic testicular pain, fever, strong odor. See a urologist immediately. Pink, red, or brown. Blood in the semen, hematospermia. Always requires investigation, especially over age 40. Pink equals fresh blood, small amount. Red equals more fresh blood. Brown/rusty equals older, oxidized blood. More on hematospermia later. Clear or very watery. May indicate low sperm count, oligospermia or azoospermia, very frequent ejaculations, duct blockage, hormonal issues, or natural aging. Worth a semen analysis if fertility is a concern. Very thick, gritty, or lumpy. Severe dehydration, hormonal imbalance, or partial duct blockage. Evaluate if it persists despite good hydration. Semen smell. When is it a problem? Normal smell, mildly alkaline, often compared to chlorine, bleach, or slightly sweet nutty, due to spermine, which has antibacterial properties. Diet affects smell: asparagus, garlic, onions, coffee, red meat, dairy. Stronger smell: pineapple, melon, citrus. Milder, sweeter. Bad smells that need attention: strong fishy or rotten odor, almost always bacterial infection, prostatitis, STI like trichomoniasis, etc. Extremely sour, acidic, possible fungal infection or pH imbalance. Unusually sweet, fruity, poorly controlled diabetes, excess glucose in fluids, complete lack of smell. Rare. May indicate prostate-seminal vesicle dysfunction. Painful ejaculation, dysorgasmia, never normal. Affects 1 to 10% of men, much more common after 50. Pain can occur just before, during, or right after ejaculation. Most common causes after 50. 1. Prostatitis, acute chronic bacterial or chronic non-bacterial pelvic pain syndrome, burning pain, pelvic, rectal pain, urinary symptoms. 2. Benign prostatic hyperplasia, BPH, pressure and inflammation. 3. STIs, chlamydia, gonorrhea, urethritis, epididymitis. 4. Stones in prostate or seminal vesicles. 5. Blocked ejaculatory ducts. 6. Pelvic floor muscle tension, chondrospasm. 7. Neurological issues, diabetic neuropathy, multiple sclerosis, etc. 8. Severe performance anxiety or psychological trauma. Seek help immediately if pain is sudden, severe, plus fever, GI, chills, or if persistent, more than 3 episodes. Blood in the semen, hematospermia. Terrifying, but in men under 40, it's usually benign and resolves on its own. In men over 50, always investigate thoroughly. Common causes: vigorous sex after long abstinence, recent prostate exam, biopsy, trauma. Infections, inflammation, prostatitis, urethritis, etc. BPH, enlarged prostate ruptures. Tiny blood vessels, stones, polyps, cysts, high blood pressure, or blood-thinning medications. Rarely, prostate cancer, seminal vesicle cancer, or other tumors. This is why investigation is crucial over 50. Urgent evaluation needed if persistent 1 month, recurrent, age 50, additional symptoms, pain, weight loss, urinary problems, family history of prostate cancer, or elevated PSA. Volume and consistency changes. Normal volume, 2 to 5 milliliters, 5.5 milliliters, hyperspermia. Usually long abstinence or inflammation. Consistency issues: doesn't liquefy after 30 minutes, prostate enzyme deficiency or infection, very watery from the start, low sperm count or gland dysfunction, lumpy clotty, infection or severe dehydration. Red flags: see a doctor immediately. If you notice blood in semen, especially if recurrent or age 40, yellow-green color plus bad smell/pain, persistent painful ejaculation, strong fishy/rotten smell, sudden major changes in color, smell, consistency, or volume, very low volume, plus other symptoms, fever, chills, severe pelvic to testicular pain, urinary problems, unexplained weight loss. How to keep your semen and overall health. Optimal after 50. Stay well hydrated, 2 to 3 liters of water daily. Eat an antioxidant-rich diet: fruits, vegetables, nuts, seeds, omega-3s. Cut processed foods/sugar. Exercise regularly, 150 minutes moderate aerobic plus strength training weekly. Avoid excessive heat to the groin, no long saunas, hot baths, laptop on lap, tight underwear. Quit smoking completely. Limit alcohol to 1 to 2 drinks per day. Max. Manage stress, meditation, yoga, good sleep. Practice safe sex and get regular STI testing if needed. Ejaculate regularly. Studies link approximately 21 times per month with lower prostate cancer risk. Annual prostate exam plus PSA testing after 50 or 45 if high risk. Never use anabolic steroids. Final message. Your semen is far more than just reproductive fluid. It's a valuable window into your overall health. Changes in color, smell, consistency, volume, or pain can be the very first signs of treatable infections or more serious conditions that need prompt attention. Please, never ignore symptoms out of embarrassment. Urologists have seen and heard everything. There is no topic too awkward. What should truly embarrass us is neglecting our health out of fear of talking about normal body functions. Millions of men worldwide face these same issues. Help, effective treatments, and supportive communities exist. The hardest but most important step is deciding to seek help. You deserve full health, vitality, and quality of life at every age. Aging is not an excuse to accept troubling symptoms passively. Many conditions are treatable or even reversible. Be proactive. Listen to your body, maintain healthy habits, get regular checkups, and see a doctor promptly when something feels off. If this video helped you, please give it a like. It helps the algorithm reach other men who need this information. Share it with a friend, brother, father, or colleague. Sharing health knowledge is one of the greatest gifts you can give. Leave your questions or topic suggestions in the comments. I read every single one. If you haven't already, subscribe to Male Secret 60+ Pour It and turn on notifications. Together, we're building a shame-free community where men can talk honestly about health and live with greater dignity and well-being. Remember, taking care of your health isn't vanity or weakness. It's self-respect and responsibility. You deserve to live well and feel great in every decade of life. See you in the next video. Wishing you a week full of health and vitality. A warm hug from Dr. Jane Taylor.